from AIDS? Where was the FDA? 42,000 dead from AIDS. Where was the FDA? 42,000 dead from AIDS. Where was the FDA? 42,000 dead from AIDS. Where was the FDA?
It is 1983. It has been 2 years since the first cases of pneumocystis carinii pneumonia were reported to the Center for Disease Control. Since then, over 600 deaths have been reported. The CDC has only just named acquired immune deficiency syndrome in September. Before that, it was referred to in the media as a gay plague. There has been no government response.
White House officials confirm that the president has never talked with his Surgeon General about AIDS or read the report Dr. Koop sent him last October.
The fact that it has taken the president 5 years to begin to even address this problem publicly demonstrates that this administration hasn't given it the level of commitment that it deserves.
President Ronald Reagan has not spoken on AIDS and will give one and only one speech in 1987 that addresses AIDS. He calls AIDS
public health enemy number one.
Establishes the President's Commission on the HIV epidemic. It is largely ineffective, and then will leave office in 1989 without doing anything else. In 1987, Congress will explicitly ban the use of federal funds for AIDS prevention and education campaigns that promote or encourage directly or indirectly homosexual activities, limiting any outreach efforts made by the federal government. The AIDS epidemic exposes and exacerbates the multiple fault lines of social and economic inequality and justice, revealing our political system's weak points. Because the disease is much more prevalent in marginalized groups, gay men and drug users in particular, and because Reagan's administration allows only partial measures and inadequate funding, even as the CDC understood how potentially dangerous this outbreak was, there is no immediate action taken, which turns out to be fatal for hundreds of thousands of people. However, much has already been said about the lack of cohesive governmental response to the AIDS crisis. As a result of the government's passiveness and sometimes even blatant interference towards the epidemic, the LGBT community draws together. Sometimes with other affected communities, sometimes without. The AIDS-positive LGBT community must work things out for themselves and become their own doctors, researchers, and legislators.
This has clearly been written by people who were very knowledgeable, very intelligent, and really wanted to do the trials the best possible way.
It is 1983, and the start of AIDS activism as we know it begins here, with the Denver Principles, a list of 17 principles drawn up by AIDS-positive activists, outlining the demands of a community that is being devastated by the disease. The sign they carry, "Fighting for Our Lives," becomes iconic. Over a dozen people stormed the Second National AIDS Forum at the National Lesbian and Gay Health Conference in the June of 1983, demanding that instead of being talked about, the conference hear directly from people actually affected and infected. It establishes the tone for AIDS activist groups for years to come. Forceful, loud, determined in the face of a staggering amount of deaths, and fueled by the emotional turmoil of friends and loved ones dying around them with no tangible reaction from the government.
My friends, David Evans, Nicholas Kaiser, George Marshall, and my beloved brother, Dennis J.
Of course, the Denver Principles themselves are a powerful statement, but it just isn't enough to mobilize institutions into revolutionizing the way they thought of patients, and AIDS patients in particular. Government indifference continues well into the 1980s despite the principles.
Join us in this chant. 300,000 dead from AIDS. Where is George? 300,000 dead from AIDS. Where is George?
And the Denver Principles don't even reach the ears of the public. When polled as late as 1986, some 50% of Americans consider it people's own fault if they get AIDS, and 54% think that people with AIDS should be made to carry a card to this effect. Many are concerned and often misinformed about how AIDS was transmitted.
I see some of your men are wearing plastic gloves. Did the department provide them?
Yes.
Why?
That's up to the individual officer as to whether he wants to wear them or does not want to wear them.
47% said they would avoid someone who tested positive. A headline by the New York Times in 1986 noted that for the last 3 years, anti-gay violence had been on the rise because of publicity surrounding the spread of AIDS. Cases in New York had doubled over the past year alone, and while the death of Rock Hudson, a famous Hollywood celebrity, raised awareness of AIDS, it only added to the fear felt by the public. It did nothing to alleviate the homophobia surrounding the disease. Public perception of AIDS as a gay disease and the scapegoating of gay men was as firmly rooted as ever.
Have to factor in the sensitivity of those of us who feel that there's a spiritual and moral aspect to this playing to the homosexual lesbian crowd. It makes it different from anything else.
There are several AIDS activist organizations that develop in the wake of the Denver Principles: the National Association of People with AIDS, National AIDS Network, and Federation of AIDS-related organizations, for example, but the most influential and noted by far is the group ACT UP, formed in 1987. It is incredibly effective in achieving its goals, though they face considerable opposition in doing so. From the beginning, ACT UP is the subject of domestic terrorism and civil unrest FBI investigations, and faces police brutality and legislative intimidation. The police brutality ranges from verbal abuse to physical assault. Legislative intimidation entails the filing of multiple felony charges against activists in the group, the use of a grand jury to divide queer AIDS activists, and the indictment of ACT UP members on felony charges for protest. They also weather a campaign of harassing phone calls and death threats and derision from the mass media, who claim that they are irrational and extremist. Despite the initial resistance, their nonviolent civil disobedience and direct action tactics yield undeniable results. For instance, ACT UP, in its third year, demonstrates at the 5th International Conference on AIDS and calls for a change in AIDS treatment research, presenting the new concept of parallel track drug testing, putting non-toxic drugs on clinical trials, while also releasing them to people not on the trials.
This is it. This is the plan we're presenting. We need our government to read this plan. We need them to work with us. If they want to change it a little, we'll talk to them. But I want them to adopt it. I want them to get started on it. I want them to save our lives. Thank you.
The next week, ACT UP is asked to discuss parallel track testing with Dr. Anthony Fauci, director of the AIDS program at the National Institute of Allergy and Infectious Diseases. Days later, he announces parallel track publicly, and the government appoints a panel, which has an ACT UP member, to write procedural standards. ACT UP doesn't just force the government to change procedure about treatment, however. It forces the public consciousness to change, in ways that the Denver Principles couldn't. It may spark controversy and inspire disagreement.
Have the FDA giving you a drug. So far, you've got AZT. Why?
But its very public protests ensure that at least some measure of attention is brought to AIDS, and that translates favorably for the LGBT community. Despite widespread antipathy towards gay Americans, however, national surveys during the last 2 decades indicate a growing willingness to grant basic civil rights to gay people. Gregory M. Herrick reports in 1991 in a study about stigma, prejudice, and violence against lesbians and gay men. ACT UP and groups like it help propel public attitude in favor of the LGBT community. Surveys report that the proportion of American adults surveyed by the Gallup organization who say that homosexual men and women should have equal rights in terms of job opportunities increased, from 56% in 1977 to 59% in 1982, and to 71% in 1989. The proportion opposing such rights declined from 33 to 28 to 18%, respectively. However, while progress is being made, it's marginal and limited to the field of civil rights. Herrick says, in summary, although they show increasing willingness to extend basic civil liberties to gay men and lesbians, most heterosexual Americans continue to condemn homosexuality morally and to reject or feel uncomfortable about gay people personally. Despite the spate of anti-gay violence in the 1980s, and despite the resistance they meet, groups like ACT UP work hard to get treatment and patient rights for people with AIDS, and in doing so manage to increase tolerance for the LGBT community. Without their contributions, our current attitudes would not stand where they are today.